Good morning. My name is Crystal James, and this is your COVID-19 update for October 7th, 2023. This photo on the front is a picture from about 1 year ago of what our classrooms looked like for students. As we look at COVID-19 today, many things have opened up, as we all know, but we did start to see some early indicators of a new surge, as been the trend for the last 3 years, beginning at the middle of the summer, probably mid to late June. You can see this arc here where we were only really recording hospitalizations and deaths. These are the severe indicators, but now they're starting to actually show more of the early indicators and some more test results and emergency department visits to look at those trends. From August to September, which when those trends were pretty flat, as you can see, because testing in the States has gone down significantly from where we were around testing this time last year. Emergency room visits have kind of followed the arc of the hospitalizations, with the hospitalizations and unfortunately deaths having a more severe or more significant increase over the time period. When we look at our region, when you look at the positivity, going back to my comment regarding testing is significantly low, the numbers that you're looking at are for Region 4, and that is for all the states that you see there highlighted, down from Kentucky to Florida. And of all those states, the data through September 30th, there had only been, in that past week, 4,736 tests that were performed. And of those, 8.9% were positive, for 8.9% positivity rate. I'm sorry. In the past 2 weeks, it was 9.9%. So it is starting to go down pretty significantly, with total testing for the past 2 weeks being at 15,092 for all of these states. So the hospitalizations that you're seeing does not necessarily reflect the number of positive people that are in that environment. When we look at Macon County, more specifically in the state of Alabama, the good news is that hospitalizations have started to go down. Again, these are new hospitalizations. This does not show the prevalence or the people who were hospitalized the previous week that continue to stay in the hospital. This only reflects the new hospitalizations up through September 30th for Macon County, and the prior week with it has been a 40% increase from the previous week, with 7 people hospitalized from Macon County through the last week of September. When we look at the testing we've been able to do for the community on campus, what we see here is the beginning of August, which our fall cohort, and we close out summer at the end of July. And what we're looking at is the positive cases among all the tests that we've had over the last few weeks. The week ending September 29 was week 10, and there were 3 positives reported. I'm sorry, week 10 actually ended on yesterday, which is October the 6th, and there were 3 positives in the past week in the of community individuals that came to the university testing clinic. The week before, there was 1 positive, and the week before that, there was 3. And so we are starting to see more community members be tested at our facility, and do want to spread the word that that is available if there's no other opportunities for testing in the area. As you can see, hospitalizations have gone up significantly, and as we all know from the work we've been doing over the past 3 years, the earlier that you're able to detect that you are positive and to isolate yourself out of community, the more that we can impact the spread and also get the necessary attention so that you don't get to hospitalization. So we want to continue to do all these things that we've been talking about over the lifetime of our being together. And that's those personal responsibilities, including healthy diet and supplements, which we're going to have a series coming forward to talk to you a little bit more about what are some of those things that you can be doing to use food as medicine to help keep your immune system where it needs to be to prevent severe illness. And along with that, we're going to have today for you, Mr. Guy Trammell, who will talk about the types of things you need to ask about and to be aware of when you decide that you may want to do some of these things that are considered to be shared responsibilities, which includes this last slice here in vaccines. We know that the new vaccine for fall is now readily available, and that should be what you receive should you go to any locations. However, if you do not have health insurance, you will be charged for vaccines at some locations. There is, through the federal government, a bridge access program in which provides the 2023 COVID-19 vaccines. And these are free vaccines available for persons without insurance at the following locations. These are the two closest locations for Tuskegee Institute. That's the zip code that I put in, 36088. And these were the two closest locations that had the free bridge access. That does not mean that there's not other locations that has the vaccine available. We do not currently have the new vaccine on campus. I will order that if that's something that is needed. But because we had to throw away so many doses, I have not ordered the new batches as of yet. But I will look into that if that is a need. But until then, if you need a vaccine, would like to get the new one, and do not have health insurance, these are two locations. If you do not live in the Macon County area, if you live in Montgomery or other area, there are other locations, and you can find those by going to www.vaccines.gov and make sure you click on the button that says Bridge Access Program when you put in your zip code, and that will show you where all the locations that have contracts with the CDC for free COVID-19 vaccines. I do think that we should be advocating for the CVS here in Tuskegee to build that relationship with CDC so that they could provide the Bridge Access Program vaccines. They're the very same vaccines that you would pay for at those same locations. They just have an agreement and receive the free doses from the CDC. I hope this information was helpful, and I'll now turn it over to Mr. Guy Trammell, who will give you the update on the things that you should ask about and be aware of as you go in and make decisions about whether or not you will take the new vaccine that's available for fall 2023. Thank you.